Hi, everyone. I'm Erin Martin, and this is on Prescribing Food as Medicine. Thank you all for joining us. And I want to start with this quote, a verse from the Bible that says, "Do you not know that you are God's temple and that God's Spirit dwells in you? If anyone destroys God's temple, God will destroy him, for God's temple is holy, and you are that temple." This is so important to understand the spiritual connection with food and what God has produced for us to heal our bodies, to nourish our bodies, and to really give that to our temple so that we are able to connect deeper with God. I really love this verse. A little bit about me and my story. My background is in long-term care. I've worked in long-term care since I was 15 years old. I started working in a retirement community for people who are 55 and older. And I was just mesmerized by wisdom and authenticity of older people. And I worked in all levels of care, from independent living to assisted living to hospice care. And I worked in HUD housing, low income housing, for 62 and older as director of social services for a couple years. And I saw a lot of things, and I was going to a master's program in gerontology, which is the study of aging, at the same time. And I was learning about what real and natural aging is. And I was comparing that to what was happening in real time and the people that I was serving. And I was seeing people on 15 to 32 prescription drugs. And I followed the systems and I looked at what food was available, what the insurance was and wasn't paying for. And I saw this as a real crime to people, and that it dawned on me, and I kept asking God, like, what is something I can focus on? There's all these issues in aging and in long-term care and in healthcare, and where could I put my force into, and where could I affect change? And I kept asking and praying to God about what that would be. And he kept saying that it's the food. It's something we're ingesting 3 to 5 times a day, and no one's connecting that directly with their health. And so I saw clients one-on-one privately and helped them come off of medications, or empowered them to make those their own just choices and change their lifestyles. And people came off of drugs and they got better. And they saw chiropractors and they came off of walkers in 6 weeks. And I thought, how interesting. And I traveled to Italy and I started studying the blue zones of the world, where people age the longest, and they ate local, seasonal food. And if it's local, it's going to maintain more of its nutrients if it's fresh, and started really understanding that. And then I got some training through a nonprofit called Kiss the Ground. There's a great documentary on Netflix, and started understanding the soil science of what soil health practices create even more nutrient dense food. And I saw this huge opportunity to not only revolutionize healthcare and aging and happiness and health, but also the local economy and local farmers. And I started really realizing that farmers are really these longevity heroes with all of this responsibility. And as they start to learn more about their practices, that they are connecting directly to health outcomes, and that we are able to affect this. And so during the pandemic, I had a lot of free time, and I found a North Tulsa doctor who wanted to run a food prescription program. And that's kind of how it all began. And I'll share more detail about that as we go on. There are 116 active produce prescription programs in the United States. There's lots of different types of programs, and we studied many of these programs before launching FreshRx Oklahoma. We actually became the first Tulsa funded program through the USDA produce prescription program, and we are funded through 2025. We started off with several local healthcare funders and still work with them, but have been additionally recognized nationally through the USDA. And we have, alongside one other program in Oklahoma City, we became the first two funded in Oklahoma to do a produce prescription program. And produce prescription programs are where oftentimes a doctor in a clinic refer based on food insecurity or a diet-related condition. We looked at diabetes because of the history of diabetes, especially in the North Tulsa area, which is a food desert, predominantly low income, with lots of mortality rates from diabetes. So that was our focus when we began. This is our logo, Fresh RX Oklahoma, and we started in North Tulsa. We started with 2 clinics and a particular doctor, and now we are partnered with about 6 clinics, but probably seeing people from 10 clinics in kind of the North Tulsa and Tulsa area. We started off seeing 50 people in our first year and now have enrolled an additional 100 people. So we have enrolled 150 in our program and looking to continue to serve that many people, and if not, expand to other areas in Tulsa. How we began was a doctor, Dr. Farish, right in this picture with me. He saw that his patients were compliant in their medications and their doctor's visits, but they still had uncontrolled diabetes, an A1C of 8 or above, where they were at incredible rates and risk of having stroke, heart failure, amputation, you name it. And he actually heard about a produce prescription program that we studied called the Geisinger study. And it looked at using diabetes with a hybrid of both education and produce to help people lower their A1C level. In the program, we kind of based ours off as they were able to reduce someone's A1C by 1 to 2% in the year, which they equated as healthcare cost savings from $16,000 to $24,000 per person per year for people that would maintain those A1C reductions, and really using the education to empower them beyond the program. And they had a 12-month program, and we based that program very similarly. And Dr. Farish, who partners with who is a physician of Crossover Health Services, a Christian clinic that we began with, really cared, and he was really a care champion for this program that empowered his patients and the other doctors, and has now influenced other doctors to spread this message and refer this program. So we're really grateful for Dr. Farish and our ongoing partnership and relationship with Crossover Health Services. So who do we serve? We have kind of 3 main focuses. One is the clinics. And so we partner with those clinics to get referrals, and we have an awesome referral program and enrollment process. The physician refers directly to us. We get health metrics through them. So we're measuring health metrics every 3 months. We partner and get that information from them. We keep them updated on their clients. We serve the direct patient. And so the first group is we serve clinics and physicians and help them reach those healthcare goals. And then we are obviously serving the patient themselves. And then our other focus is really serving the local farmer. And so we have a farmer cohort of about 15 to 20 farmers that we have vetted, and we know their soil health practices, and we work with them to grow more culturally appropriate foods for the people that we're serving. For example, there were no local collard greens, and most of the people we serve are of color who really love collard greens. And so we commissioned one of our farmers to grow collard greens. So that's one of the ways we've been more aware of what kind of foods we're serving and who we're serving and how we can best serve them. And so we know that the integrity of our sourcing is just as important as the patient outcomes. And our program really depends on these farmers scaling, because one of the major issues with why we have food deserts, why we have so much sickness, is because of the way we have farmed for 100 years, that we've really depleted our food of nutrients. And so it's great to have grocery stores and food deserts, but if they don't carry healthy, fresh food, they're still contributing and exacerbating those chronic conditions. So we wanted to go kind of beyond that and beyond sourcing just from a food bank or Amazon or Walmart. And we wanted our money to stay in the community and help these small scale growers grow. They have expanded in many, many ways, from increasing their production to increasing the diversity of crops available and to creating a more equitable food system. Because it was my belief that if the people we're serving have the least amount of access to healthy food, that they should get the best that's available. And from the taste of our food and the energy around our food, we know it's even better than what you're getting at Whole Foods, because it's not prematurely picked or artificially ripened, and it is the best carrots you've ever had in your life, even for our staff, all of our participants, which aids in compliance for people. If it tastes good, they're going to keep eating it. So we really enjoy that part of it. So 3 major people who we serve are organizations. One's the clinics, healthcare system, the patients themselves, and our local farmers. So here's a little bit about our program details. We have kind of 3 main parts to the program. One is we do food distributions. So for 12 months, every 2 weeks, they get fruits and vegetables that are locally grown and harvested just a few days before they get them. We do this all out of our North Tulsa Health Department. So we kind of pop up as like a mini farmer's market, and our participants can come in and find the stuff that they want, but it's still curated. So we're still controlling kind of the selection, but they have choices within that selection. So every 2 weeks on a Wednesday morning, our farmers harvest on a Monday or Tuesday. We bring our food to the food hub, and the food hub brings the food over, and we kind of pop up in the North Tulsa Health Department. And the second component is our education. So every month they have multiple opportunities to come to a cooking demo or a nutrition class. So there's accountability there, making sure they're engaged in both showing up for the distributions or getting delivery, that is an option, and then making sure they're going to education classes as well. And then the third component is that they're going to their regular doctor's visits. So we get the updates on the 3 health metrics that we measure, which is their A1C level, their weight, and their blood pressure. So 3 major parts: food, education, and the healthcare clinic visits and meeting with your doctor. So I mentioned several times already that we have standards on what food we're sourcing and how it's grown, and that people with chronic conditions, we certainly could get conventional fruits and vegetables, and certainly their health would still improve if they increase their consumption of fruits and vegetables. But we strongly feel that we want to not only stimulate health outcomes and healthcare cost savings for our healthcare system, but also create a more local, equitable, and ethical local food system, which we believe aids in all these increasing chronic conditions. So we feel very strongly about where we get the food and how we source. And we really feel strongly that we need to support local and underserved farmers. So we are looking at supporting farmers where they are. We empower them to dictate what prices they're selling at so they can live a living wage. We have a problem in America where our average age of farmer is over 60. And so we need to cultivate new agricultural entrepreneur opportunities with even value-added products and creating that to be available. So we work in tandem with the Conservation Commission and the Oklahoma Association of Conservation Districts. They do a lot of advocacy for farmers that are historically underserved, from Black and brown farmers to veterans to women. And we've gotten our farmers funded for hoop houses. And luckily, our funders have really seen that the importance and the development of our farmers is just as important as the patient outcome, and they actually directly depend on each other. So we do farmer trainings. We've supported with labor on farms to ensure that we're getting the best quality to the people that need it the most. So this is a little bit of a deeper understanding, and I won't go too far into this, but basically when your grandparents were young, you could eat an orange and you could get the same amount of vitamin A and vitamin C out of that orange. Well, because of the way we've farmed for the last 100 years, we've degraded our soils. And you actually have to eat 6 to 8 oranges to get that same vitamin A and vitamin C. And our bodies are self-building houses. They're healing. If they get what they need, they can heal. But our food is depleted. And so that's why we supplement with vitamins and different things like that. And so where our nutrients comes from is this says SOM, and it's the soil organic matter. This is all the decayed roots and bacteria and all the good things that we need in our food. And so without this, we don't have a translation of nutrients to the plant. Even if it's in the soil, it can't translate it. It doesn't have the translators. And so big translator is like the mycelium and the fungi. And when that gets killed from chemicals, then there's no translation. So even if there is nutrients in the soil, it doesn't get translated to the food, to the plant, and the food from the plant. And so over 100 years, you can see we have degraded the soil from having 10% organic matter to having less than 1% in most areas. So even when we have local food, but if it's not, the soil's not being treated right and not rebuilding the soil organic matter, we have a lot of challenges. So we've done soil testing on our farms to see that they are rebuilding their soil organic matter. And actually you can correct that in a lot less time than we created the issue. And so this is just a little bit of an understanding of how we've depleted the soil. So not all food is created equal. And there are people that have rebuilt their soil that have more than 10% organic matter. They have 15% or 20%, and they can continue to rebuild that and make richer and richer food that helps us in our bodies. And so over time, this gives you a little bit of another picture about how even from 1940 to 1991, how mineral depletion has happened in vegetables and even our meat production. Copper declined from 76%. So this is 30 years ago, and this is a scale of 50 years. And so you can see by how incredible this has declined, and you can just imagine how much more it has declined. And so through my studies and my understanding, I think this is why we're seeing these incredible rise in cases of chronic conditions. This is a projection from 2003 to 2023 of the increase of this, and we have millions and millions of people with diabetes and prediabetes, as you all very well know. And we also see that mental disorders increase, that probably 60 to 70% of our patients also were diagnosed with anxiety and depression, and that depression actually makes your sugar levels worse, and it all is very secular. And so we are whole beings, we are whole people, mind, body, and spirit, and we have to be treating the whole person. And food is a great entry point to do that. There's certainly other emotional things underneath there, and there's other challenges and barriers in life, but I feel like food is this great entry point that if you teach people to fish, that they will be able to make vast improvements. And we've had people have incredible health outcomes that I'll go over a little bit more. And so converting to positive soil health practices can change this, can change all of this, all of these issues that we're having with health that are diet related. It changes animal health, plant health. Plants get less diseases because the soil is healthier. That helps with climate. The way that you farm, when you care about soil health, it actually carbon captures a lot of carbon back into the soil, which goes back into that soil organic matter, which goes back into us. So it is this huge, giant ripple effect that is so incredibly beautiful. And, you know, God created this technology in the soil that cannot be replicated by a mere mortal. And it is just so beautiful. And we've tried to learn about the soil technology and understanding the science. And we thought we knew about 10% about how it works. But in the last like 10 to 15 years, we've realized we know less than 1%. So we're not going to recreate what God made in a lab. And so that's why it's important for us to be stewards of the land and work with the land and protect the land, because the land is us, and everything everything is under God, and it's and created by God, and so we want to work with that and nurture that and not force it and not use it for gain, for financial gain, and exploit it. And that's what's happened for so long, which is why I believe we've become so sick. And there's a great organization called Bionutrient Association who does research on nutrient density and seeing where there are differentiations. So like I mentioned before, not all food is created equal. And so they've noticed that by doing some testing on different crops. So you can see they did 21 crops from 2018 to 2020 that revealed significant variation in nutrition value. The variation assessment is a compilation of 6 elements: calcium, iron, potassium, magnesium, zinc, and sulfur, and 2 compounds, antioxidants and polyphenols, as they are generally proven to be linked to human health in positive ways. And so in this illustration, the number by each crop indicates how many in the lower end of the variation one would have to consume to equal 1 from the higher end. And actually, spinach ranges from 365 to 1, which means if you eat the least nutrient-dense spinach, you'd have to eat 365 of that same spinach that you could get in one that was grown better. And what they have found from kind of establishing this continuum of nutrient density in foods that are currently on the market, they have found that if it's grown with good soil health, which is also referred to as regenerative farming, it creates oftentimes the most nutrient dense food that's available. And another great measure of that is your tongue. It's actually the first most reliable source of understanding nutrient density and knowing that if it tastes good, your body's going to recognize it. Like, we are a computer and we are trained. And if we get all the nutrients we need, our brain has something that turns off that says, I'm satiated. I have all the nutrients I need. I don't need to keep eating. But because we're not getting nutrients in highly processed foods, it's all calorie based, which we know is not a good measure for health. We're not getting everything we need. So we just keep eating, which leads to obesity and overeating. And your tongue knows, it knows the difference. Here's some data on our program. This is from the first 6 months of our pilot program, and I can also share some additional data as well. We had, in the first 3 months, we have 16% of out of 52 people go from uncontrolled to controlled diabetes. After 6 months, 23% of them, that means they went from above an 8 of an A1C below an 8. And after the program actually ended, after 6 months, it says here that the average reduction was 1.98% for A1C, which is huge. Our largest reduction was from a 14 to a 6.9 in 6 months. And our cohort lost 296 pounds. And our average reduction maintained throughout the whole year. And actually, it raised a little bit. It was about 2% or 2.1%. We estimated that with just 52 people, we saved in healthcare costs nearly $750,000 just with 52 people. The University of Oklahoma did a study on us and said if we maintain these data points and we served 1,500 people, that we would save the state of Oklahoma $25 million in healthcare costs. And we also prevent hospital readmissions, which is something we are trying to measure additionally. So I think that might even be a low end of the spectrum, that we would save the state a lot more money than even can be rationalized. In our second cohort, we're about 6 months through. We have maintained all of this type of outcomes. We've had similar outcomes. Our average reduction is a little bit higher. It's about 2.2%. And we're just really hopeful that we can continue to replicate as we expand. And we seem to have pretty good retention in our program. We stay very connected and very much work one-on-one with clients that need extra help, and making sure that they stay engaged in the program. So we are really, really excited about this data and have additional data as well. We measure pre and post their general health. We look at whether they've increased their consumption of fruits and vegetables. We look at pain management, socialization. So this data right here is just off of our health metrics, simply that. And then we measure a lot more items beyond that as well. We use the SF12 screener, which is a health survey, and then we use a nutrition screener as well. And this is a little video I wanted to share with you all about one of our participants. So I'll let you guys watch this real quick.
And says access to locally grown fresh fruits and vegetables is really improving her health.
She participates in the Fresh RX food program and tells News on 6's Sawyer Bussey she's already seeing an improvement in her diabetes numbers.
Well, you got a lot of colors there.
Oh, yeah. That makes it pretty. That makes it pretty.
Welcome to Deborah Cooper's kitchen.
And put my peppers and onions in first. Like I said, they don't make you feel like you're getting a handout. It's like come and get some longevity.
It hasn't always been this way.
I was best friends with Little Debbie and her snack cakes.
Deborah says unhealthy foods were also friendlier to her budget and at times much more accessible than fresh local produce. Over the years, Deborah's sweet tooth started impacting her health. She was diagnosed with type 2 diabetes in June, and as a patient at Crossover Health Services was connected with the Fresh RX team.
Our body can heal itself if it gets what it needs.
Fresh RX is partnered with Oklahoma farmers, community partners, and patients at Crossover Health Services to bring fresh, locally grown produce to 52 participants with dangerously high A1C levels and type 2 diabetes.
Food is medicine, and it has this huge ripple effect.
Deborah is one of the Fresh RX participants. In less than 11 weeks, her A1C levels have gone from a 10.6 to a 7.1.
They gave us all of these recipes with the items we were picking up. So that's like you gave me not just a car, but you gave me the keys too. I have even passed up Debbie. I see where they set them out. I just hold my head up and say, girl, bye.
Deborah is a pastor of a growing ministry, and her physical health is starting to match her spiritual health. She says the same results are possible for others.
What I'm called to do, I want to be here to finish it, and I want to do it in excellence. And this program, it is like changing
Real outcomes, real food, real people.
Sawyer Bussey, Oklahoma's own.
You should have your own cooking show.
News on 6.
Think you should.
What's really cool about this is it's different from other food programs because it's not just a food giveaway program. It's a come and get some longevity, and they feel empowered and they feel cared for. It's not just a food giveaway. And that's really, really important to understand that this is an engaged program with accountability. They learn other ways to find food, and they have other support and resources. We really get to know these people and have intimate relationships with them. And what's really cool is we ended up hiring Deborah, and she's our outreach coordinator and works in the community and goes and meets people where they are and really helps them and really can see what other issues they're facing. And so we can help address those as well. So a very famous quote by Hippocrates, the founder of Western medicine himself: "Let food be thy medicine, and medicine be like thy food. What else?" And Wendell Berry just has some incredible quotes, and I really liked this one as well. "A medical doctor uninterested in nutrition is absurd as a farmer who is uninterested in health. And I see it all over the place. I speak to groups of 500 farmers at a time, teaching them about how their work connects to human health and aging. And it's amazing how many farmers have diabetes themselves. So we are all just so disconnected from not only ourselves, but with our food. And this is a way to reconnect. And I believe to reconnect with yourself and reconnect with God in many, many beautiful ways. So I also challenge you to leave a legacy of food as medicine and its amazing benefits, and not to discard the value of food, of real healthy food and what it can do, and live by example. It's way better to live by example than force other people to do things or try to. So I live by example and I eat a very healthy diet. And so people I love see that, and they often will choose to make choices by you living as example. So I challenge you to do this personally. And if you're interested in starting a program like this, then you'll be a great example for that. Here's some of my information. You can reach me at my email at erin@freshrxok.org. You can find out more information about us at freshrxok.org, our website. And then we're on Instagram and Facebook and YouTube. Our cooking classes are all on YouTube at freshrxok. And please feel free to connect with us. Thanks so much for listening.